Hi, my name is Carbonilla, and for today's checklist, I will be doing the newborn injection checklist. So here's what we need to prepare. A 2-piece 1cc syringe, but since I don't have an extra, I'll just assume this is a 1cc syringe. Next is we're going to prepare a aspiring needle. And the purpose of this is to aspire what's in the medication, which let's assume I only have one bottle right now, but let's assume this is a vitamin K, a hepa shot, and as well as a BCG. Next is we're gonna need our dry and wet cotton balls. There's another pair of cotton balls which has alcohol, and we're gonna need these clean gloves. After that, a medicine tray, and as well as a medicine card. After collecting the things that we need for this procedure, now we're gonna have to do is look into special nursing considerations. The first is we're gonna have to look at the safe dose ranges that we're gonna be administering to the client, especially for this baby. Next is we're gonna have to know the purpose for this administration. First is, of course, we're gonna be immunizing the baby at the same time to avoid any possible complications, and that's why we're administering the medications. And next is we're gonna have to know the adverse effects and what the medications may probably give to the baby. The purpose of this is to we should know the therapeutic effect of the medication. At the same time, we can also educate the parents on what type of medication we're going to be administering on their child. So from there, we're going to have to perform hand hygiene. After performing hand hygiene, we're going to have to check on the expiration dates on the medications. Now, the purpose of this is to avoid any nursing malpractice or medication errors. At the same time, we should also have to look into, if needed, we have to look into the right calculations that might be used or may be administered. Now, what we're going to be doing is we're going to be preparing the vitamin K, and we're going to aspirate it. Now, first is we're going to prepare our needle. Dispose. We're going to write in the medication card. Next is what we're going to be doing is the hepatitis B vaccine. Now, what we're going to be doing is now let's say this is a vial, the hepatitis B vial, wherein we put the sediment of the hepatitis B vaccine, and what we have to do now is we have to shake it properly. I don't have one at the moment, but I don't want to shake this because the water might go out, but what we have to do is we have to shake it properly. After that, that's when we're going to start aspirating it. Now what we're going to do is get your needle again, going to aspirate at 0.5 ml. After aspirating, remove. After removing, out. Suppose should be tight. We're preparing the medication. Back in. Write it down. And now for BCG. Let's assume this is the BCG vial, and you should remember not to shake the BCG vaccine. Now, Now what we're going to be doing is we're going to be using this. This is actually the required syringe for most, but this is the only one I have right now because I used it on a person. So yeah, right. Grab on the needle, pull out the vaccine, orient tightly. We're going to be aspirating at 1, 0.1, 0.5 ml. You're done, and we're done. Back in. The bubbles are out. Have to make sure it is placed in tightly. Aspirate. Okay, now it's done. Again, write down the medication, and this is where we start. Now after that, after getting our medication, as we can see, medication needed. Now what we're going to be doing is we're going to have to ensure the newborn receives the medication at the right time. Now this is due to hospital policies. This is the time that will allow us as well to administer the medication. Now next what we're going to do is we're going to again perform hand hygiene. Now after performing hand hygiene, what we're going to be doing next is we're going to have to identify the newborn. For identifying the newborn, we can check it on this band. Let's assume, yeah, the baby's band. So we're gonna have to identify the baby that's gonna get that we're gonna be administering. After preparing your medication, as you can see, what we're gonna be doing now is we're gonna have to ensure the newborn receives the medication at the right time. This is due to hospital policies. Due to hospital policies, we can only inject babies on a certain period of time. So next is, now what we're going to be doing is we're going to be performing hand hygiene. And after performing hand hygiene, we are supposed to use PPE if needed. At this point, since I still do not have a PPE, let's just assume I put on my PPE. And the purpose for that is to avoid transmission of organisms, especially this is a baby and we're in the sterile field. Next is we're going to be identifying the newborn that we're going to be administering. So to identify the newborn, we're going to have to check most commonly on the baby's tag. Let's assume this is my baby. And the purpose for this is to prevent medical errors. We might be administering medication to a wrong baby, or medical errors, and we would want to avoid that. So we should know who is the baby that we're going to administer the medication on. And from there, that is when we are going to be putting on our gloves. After putting on the gloves, now we're going to be selecting the appropriate administration site for the baby. Now what we're going to be doing on this baby is we're going to be administering it on his vastus lateralis on the left side and on the right side. That's for the HEPA and the vitamin K. And for BCG, we're going to be administering it on the baby on this side of his arm. So now what we're going to be doing next is we're going to position the newborn for the appropriate position for the site chosen. The purpose for this is to avoid tissue damage, and it also at the same time prevents injury, especially for a baby. And next is we're going to identify the landmarks. We're going to identify the landmarks on the baby, and the purpose of this is for good visualization, at the same time to avoid tissue damage as well. Now what we're going to be doing is we're going to get a cotton ball with alcohol, and we're going to be cleaning the site, the area. But remember, we should do it in a slow but circular and smooth motion. dispose. Now what we're going to be doing, we're going to be injecting the vitamin K. Don't worry, I have a bottle here disposed for the needle especially. Now next is, we're going to prepare cotton. This is my technique. This wasn't in the checklist, but this is my technique. Here's what we do. Stirring the side. Now we have to properly dispose this in a container for needles. I have a bottle here. Okay. Next is we're going to be vaccinating the baby with the HEPA vaccine. Now next we're going to get another cotton ball swab. Circular motion again. Just prepare the cotton ball. Before that, just have to dispose the needle. Now the main purpose why nurses when nurses go for the thighs is because for babies they don't have grown muscles yet, and this is the thickest that they get. Okay, from there, that's when we do that. No massaging hard. Then we dispose this properly. Now next, what we're going to be doing is the intradermal on the baby for BCG. Now what we do here usually is, instead of alcohol, we go for sterilized water. We clean it, circular motion. Get the cap needle, hold tight, dispose, and that's when we do the intradermal. After that injection, you dispose it on a proper bottle, and after that, that's when we can put as well the cage. After doing everything in the baby, now we're gonna have to return the baby gently to its mother, and after returning it to its mother, that's when we're gonna have to document the findings, and we have to document the administration on what we administered to the baby, and we're gonna evaluate the baby, the newborn's response, and what if the medication was appropriate. After we're done, what we're gonna be doing is we're gonna place the baby in a comfortable position. More better is we're gonna have to return it to the mother. After returning it to the mother, what we're going to be doing is we're going to have to remove the gloves properly. after disposing, we're gonna document what we administered to the baby. And the purpose of this is not only that it's hospital regulations, but at the same time this is also for therapeutic treatment for the baby and also the parents. And you could also know what was the baby's reactions, if there was anything wrong. And that's it.